You're listening to Gender, a Wider Lens.
I'm Stella O'Malley, a psychotherapist in Ireland.
And I'm Sasha Ayad, an adolescent therapist in the United States. Since 2016, my practice has been exclusively dedicated to gender questioning teens and families impacted by gender dysphoria.
I also work with gender questioning teenagers, and I facilitated support meetings for families and individuals who've been impacted by gender issues.
We're curious about the concept of gender and how it's unfolding in the wider culture.
Join us as we look at gender through a wider lens.
Dr. Az Hakeem was born and brought up in North Wales and has lived and worked in London since studying medicine. He's a consultant psychiatrist who previously trained in forensic psychotherapy, mentalisation based therapy, and is a group analyst. He previously worked within the NHS in forensic psychotherapy, specialising in analytic psychotherapy for conditions relating to sex, gender, sexual perversion, and violence at the Portman Clinic of the Tavistock Portman Clinics. Dr. Az Hakeem is unique in that he is the only consultant psychiatrist in psychotherapy who specializes in the application of exploratory psychotherapy to persons who suffer from gender dysphoria. He set up and ran the only specialist psychotherapy service for adults with gender dysphoria in the UK, in the NHS, and he's the author of Trans, Exploring Gender Identity and Gender Dysphoria. After over 15 years of working in the NHS, Dr. Hakeem now works exclusively in private practice. In addition to his clinical work, Dr. Hakeem has worked as a consultant to the media, on-screen specialist, and TV co-presenter on a number of television programs in both the UK and Australia. Dr. Az Hakeem considers himself a gender-critical psychiatrist. This was a fascinating conversation, especially while talking about the groups that he ran, where it was a blended population of individuals who had already gone through transition, as well as individuals who were seeking to go through transition. It's absolutely remarkable to note that less than 2% of the patients who were in these groups prior to transitioning decided to go on and have the physical sex change. And the 2% that did had a much more realistic idea of what transition means and what identity means and how transitioning changes your body and your life in ways that it doesn't. So even though these were not psychotherapy groups aimed at any kind of reconciliation with the body, it was really fascinating to hear Dr. Hakeem talk about how combining these two groups of people really helped everyone to make sense of their experience. So here's our discussion with Dr. Az Hakeem. Hi, Stella. How's it going today?
I'm very well. How are you, Sasha?
I'm doing well. I'm excited to introduce our first British guest to the Pioneers series. Dr. Az Hakeem.
Welcome.
Thank you very much. Welsh, even.
Welsh, true. You live in the UK, though. Is that fair to say?
Yeah, I live.
Okay. All right. So our Welsh
Wales is
guest.
in the UK, Sasha.
Okay.
You're such an American.
Welsh. I know. I really am. Well, thank you for joining us on the show.
Thank you for having me.
You have years of experience working with gender identity and trans and transition and detransition and all of these things. So where should we start? I know you have a long history with this population. Can you maybe take us back to how you got interested in working with this group of people?
Yeah, so I'll tell you right back to when I was a teenager, thinking, what should I do? And I could never decide whether I wanted to do fine art, because all I was really doing at school was fine art. I was obsessed with painting, or medicine. And the reason I wanted to do medicine was because I found a book on Freud, Freud's Interpretation of Dreams, in my local library in North Wales. And I read it and I thought, I don't understand what this person's talking about, but I really want to understand it. So I was torn between medicine to do psychiatry or fine art. And I applied to both and I got into both. And I sort of tossed a coin, sort of, the day before, and I decided I'll do medicine first and I'll do fine art later. Of course, I never did fine art later. But so I went into medicine, and then the idea of sex changes and transsexuals, I'd come across that from the art side, from like the Warhol Factory and all the transsexuals there, and I initially thought, this is a wonderful piece of art. This is sculpture. We can make people into different people. And I thought, well, maybe I'll do plastic surgery. So then my next dilemma was, do I do psychiatry or do plastics? And my first job as a junior houseman was in plastic surgery. I managed to convince the prof that I was a keen budding plastic surgeon. Poor guy. And I was helping do these gender reassignment operations. And I was thinking, there's something a bit mad about this, because we're changing these people into different people, but we're sort of changing their bodies. Wonder what's happening in their heads. And I thought maybe the psychiatrists know what's happening in their heads. So I went into the psychiatry, and psychiatrists weren't even thinking about what was happening in these people's heads. They were saying, "Oh, the surgeons are happy to do it, and we send them to the gender clinic." So I thought, wonder what the gender clinics are doing. The gender clinics were sort of saying, "Oh, well, we're ruling out that they haven't got schizophrenia or psychosis, so that's fine. We'll let the surgeons do it." And there was a denial of responsibility. I thought, well, I want to find out what's happening inside their heads, what's really happening in their minds, because I always find minds quite interesting. So when I was a specialist registrar, I went to the Portman Clinic, and I was one of the first trainees in Forensic Psychotherapy, which is a new specialty. And I worked at the Portman, which is a psychoanalytic psychotherapy clinic which specialises in problems to do with sex, gender, sexuality, perversion, and violence. So all the people that usual psychotherapists don't go near with a barge pole. And I had this 5-year wonderful, luxurious training where they said, well, you sort of do what you want for 5 years, which was great. So I inherited 2 psychotherapy groups from colleagues that were retiring just as I was joining. And one was a psychotherapy group for people who had regretted sex changes, post-op regretters. And one was a psychotherapy group for people who were thinking about having a sex change. So I started running these 2 groups. I thought, this is, one of these groups was really gender euphoric. Well, hey, we're going to be these brave new people. And the other was a really miserable, depressed group that was stuck in this state of mourning. And I thought this wasn't very helpful. So I merged the groups together, and I started running mixed gender dysphoria groups. And it was really helpful. It was really interesting. It worked. It was a really useful thing. So I carried on working individually with people, and then after I built a certain therapeutic relationship, I then entered them into the group, and it was what we call a slow open group, so people could stay in the group as long as they wanted, and then and I ran that for the 12 years I was at the clinic.
What sort of year are we when you're talking about this?
So I started in 2000. And I left the NHS in 2012. So it was that 12-year period.
And how long did the average person stay in your groups?
So in that clinic, it was probably the only clinic in the NHS in the UK where you could have therapy for as long as you wanted. So some people stayed for the entire 12 years. But what I found was any gender dysphoria they had seemed to go within a year of being in the group. And when they stayed on, they then took over the mantle of being another auxiliary therapist. As, oh yes, well I had this problem, and this is. So
they do that in AA and the same.
Yeah, exactly.
They stay on, yeah. And was there numbers involved? Like, did you have six euphorics and 6 regretters, or did you carefully kind of? How did you do it?
It wasn't that careful. No, so the group size was about 8, because it was what we call a small group. So I'm a group analyst, so we like to think of 8 as being this sort of nice number, because when you get above 10, it becomes the quality of the group and the dynamics change. So I aimed for about 8, and the population of my patients were there were probably about 25% who were who came in feeling that a sex change was something that was going to be helpful for them. 26% of my patients were post-operative regretters. 5% were what you'd call autogynephilia, and about 20% were transvestites. And transvestites are people that we don't really talk about anymore, but but it was a nice mix. And then it was mainly biological males, probably about 80%, and 20% biological females. So that was a sort of mix, but it would vary over time. But it was roughly like that.
So the biological females in these groups, did they have, the gender dysphoria that was quite representative in females, like same-sex attracted females who maybe were slightly more masculine in mannerisms and behavior?
Yeah, and a lot of them had a degree of internal homophobia to their own sexuality. and there may be, that may have been for cultural reasons, or and some people, it was some of them weren't particularly sexual. Some of them just didn't want to be women rather than wanting to be men, and it may have also been for cultural reasons.
And you said there 25% were seeking a sex change, 26% were regretters, 20% were transvestites, 5%
it doesn't add up to 100.
No, it doesn't.
You can overlap. There's always someone that adds those numbers up. Yeah, you can overlap. You can have more than one.
Okay, that's okay. Carry on.
But yes, but it seemed to work, and it wasn't it wasn't a conversion therapy. So my role wasn't to persuade people to not have a sex change, and it wasn't to help people through a sex change. I was being completely neutral. These are adults; they can do what they want. I don't mind what they do. All I wanted them to do was think about it, and it was an exploratory space. And the regressors said, if only we had this sort of exploratory space before we went on to have the sex changes, because no one was asking us, what do you mean? One of the regressors said, she was a post-operative female, but she'd been in the police force for many years, and she suddenly decided that she wanted to have a sex change from he to she, and then 11 years later regretted it, and then she went back to the police and said, why on earth didn't you ask me what I was thinking about? And they said, because we're being supportive. That's what I meant to do. And she went back to her family and said, why didn't you just ask me what on earth am I thinking about? And they said, because we're being supportive. And everyone kept saying, because we're being supportive. And what she didn't have was anyone going, really, you want to be a woman? Why? What's that about? No. And that's all my therapy was doing, was really trying to work out, really, why do you want to do this? What is this? And what is being a man? And what is being a woman? What's the difference? And just that breaking down to very, very simple terms. And the thing about a group is it avoided the sort of black and white dichotomy that you get in one-to-one. So on the one-to-one setting, you get someone who, if you think about the mind of someone who may be thinking in a trans way, it's very black and white. I mean, the very core of trans is a very black and white dichotomy. So it's very male, female, right, wrong, yes, I am, no, you're not, sort of thing. So in a one-to-one setting, you're primed to this pantomime, oh, yes, I am, oh, no, you're not situation. Even if you're not saying that, they sort of perceive you saying that. And whereas in a group, you've got people giving their own narrative, and then someone else with a gender dysphoria turning to this person saying, hang on, you sound just like me, but you sound completely mad. And coming from themselves, it was far more legitimate than coming from some smarty pants therapists who didn't have a clue, didn't understand, and wasn't on their wavelength. But it had far more legitimacy coming from within the group. So that was a good thing about the group.
And what was the desistance rate of those people that came into the group and wanted a sex change? Or I shouldn't say the desistance rate. What were the numbers like?
So whereas I'm saying the aim wasn't to try and change anyone's mind or thing, I looked at the population at the end of the 12 years and all the patients I had, and less than 2% went on to have any sort of physical intervention. And that 2% went in with a very realistic mindset. And they said, well, we're going to do this because we've always wanted to do it, but we know we're not going to become men or women. All we could ever become is trans men or trans women. And they were very realistic, and they knew the limitations, and they weren't sort of going into it blindly, and they thought about it for ages, but it was less than 2%.
When I read about this, and I'm having this feeling all over again, I was just like, well, there we go. This is what, as soon as I read the concept, I said, yeah, this is what we need to do. These two groups need to meet. Not even regretters. I would have just thought people who have transitioned 10 years plus versus people who want to transition should meet often. And they should meet within this context. Has that continued? Did you leave in 2012? No. What happened?
So I left in 2012. So in midlife crisis, I decided to go and live in Australia. So I left the NHS and went to go and live in Australia. Then I got homesick, so then I came back. But so that no one took over the mantle, and it doesn't exist. I mean, my father was with an orthopedic surgeon who treated high pressure injection injuries to the back of the tendons of the back of the hand, and he thought that was the most interesting thing, would go on about it forever. And I've realized that I've become a bit like that. So I realized that whereas I think doing analytic groups for gender dysphoria is really interesting, the fact that no other doctors are doing it means it probably isn't. So no one else wants to do it. But also the clinic quite rightly said, this was the clinic who was dealing with rapists, murderers, paedophiles, but they were terrified of treating this population. They couldn't think about it. We'd give weekly presentations of our work, and whenever someone presented the paedophile or the murderer or the rapist, there was no problem at all. We'd all think about it. Whenever I presented my work, they couldn't bear thinking about it. There's something about the gender dysphoria which really was uncomfortable with analysts and therapists' minds, which is interesting. And they kept trying to stop the work. They didn't like the work happening. They sort of let me do it because I would probably generate lots of money for the NHS clinic. But
that was exactly, the numbers were about to explode from 2012 onwards. The Portman is linked with the Tavistock, isn't it? The same.
The Portman is linked with the Tavistock, but it's like one of those organisations where the different components don't really. They're all very different. So the GIDS, when I was there, the GIDS was a very, very small satellite who needed to borrow rooms off various departments, but no one really felt they were part of it. And then like a malignant tumor grew and took over and metastasized, and
So before you left in 2012, I mean, you must have been aware that what was happening inside of your blended groups was quite remarkable.
Yeah.
So what happened to, I guess, that concept? Did you ever think to pick it back up? I mean, I think this sounds really, really important. And the number, that 2% number, is really shocking. And it's actually interesting because what a lot of activists often claim is that less than 1% of people regret their transition. And you were seeing a large number of people with not necessarily a detransition experience, but who had some regrets, at least about some aspects of their procedures.
But this 1% figure is a complete fallacy.
Right.
No pun intended. There's no follow-up study. So how on earth would you know? So all my regretters said, well, a very small number of them went back to the gender clinics, and the gender clinics said, there's nothing we can do for you. We've given you what you wanted. But the majority said, look, we spent years convincing our GPs, our psychiatrists, our gender clinicians to give us what we wanted. There's no way we're going to tell them it was a mistake. It's really embarrassing. So they would go and live by the seaside and regretting what they did and feeling they were inauthentic and a fraud. And what I found is that the initial feeling that they were trying to have a solution for, this sense of inauthenticity, remained, but they were now feeling inauthentic in a transgender role. So that no one followed them up. They were invisible statistics. So this 1%, I don't know where that comes from, but all my 26% of my patients were invisible to any data collection.
It's interesting you say that about authenticity, because I often think, is that the main event, that they're seeking authenticity and it fixates on gender. I saw Jazz Jennings saying in the latest series, she said to her mother in a very sad way, she kind of said, well, I don't really feel like the real me yet. And it was really sad that she's still chasing this real me, whoever the hell that is.
But what I found was that there was like a trajectory, an evolution of how someone ended up in that position, and I found that there was and I've got this flow diagram in my book. This is a gentle plug for my book, which I've managed not to mention yet, but it's available on Amazon.
I've read it. I recommend it.
Thank you.
Brilliant.
Thank you.
Very good book.
Thank you.
I was very excited when I read it.
Just need to find a publisher for my second book. Publishers are a bit squeamish at them. So in the flow chart that I've got is birth, and then after birth, there's a gender identity that's the same as your biological sex. And then at some point, at any age, there's some form of breakdown. And it may be a little breakdown or a big breakdown. It might be a depression, or maybe something organic. You may have some sort of encephalitis. But there's something goes wrong, but you recover from it. And then when you recover from it, you recover, but there's something not quite right. And there's this feeling of something not quite right. And then you have this period of time where you're searching for what doesn't feel quite right. And for people with vulnerability factors, we can go into what those are, they then locate the problem as being in the gender framework. And then they go, okay, so what's not quite right is my gender. Okay, therefore I need to fix my gender. And then they go on this trajectory, this tunnel vision. I need to change my gender, and you know, the rest of the story, you know. And I also found there was, for the people who weren't atypical or weren't transvestite and weren't autogynephilic, the very classic, yes, I think I should be the opposite sex, there was an almost 100% concordance with features suggestive of autistic spectrum disorder. I'm not going to say the autistics, I didn't test them for it, but they had the classic features that you classically find. And there was an over-representation of my population in software programmers, people with maths degrees, and things that you would associate with autism. And the thing about autism, the thing that is classic about autism is they're not able to gauge what is happening in the mind of someone else. So it's called theory of mind. So the autistic person has no theory of mind. They can only go on clues. So they struggle with getting a sense of what someone really thinks or really feels in relation to them. And to give an example of this, in my group, someone said, I went out for dinner last night and I was dressed, meaning dressed as the opposite sex. And everyone thought I wouldn't believe I was a woman. I said, well, how do you know? Well, no one said anything. I said, well, how do you know what they thought? Well, because I was wearing a dress, I had long hair, I had lipstick on, and people called me madam. And well, they must have thought I was a woman. And that's a classic example of theory of mind because all the macro clues suggest that they thought but the idea that person may have doubted or had another thought in their head that they weren't expressing. And what I found was that the more autistic someone was, the better the outcome for the sex change, and the less autistic, the worse outcome, because the regretters all had this sense of, oh, well, actually, maybe I'm not. Whereas the autistic people were protected from that because they go, yes, of course. No, everyone thinks I will be. Yes, because everyone's calling me by pronouns. I've got long hair. I've got a dress. I've got lipstick. This is what a woman is. Everyone's calling me she. There's no problem. Whereas the ones who are less autistic were going, oh, maybe they had this infiltration of doubt, and they're able to consider what might be happening in the other person's mind and whether they were doubting it. And so in a way, the autism was present, but it's also protective for the wrong reasons.
I want to mention something about that because I think about the current kind of wave of activism and the slogans, and it seems almost perfectly created for that particular type of patient. And something that I often explore in therapy with my clients is, when people use your pronouns, are you fine with it just being a formality or a politeness, or do you really literally want that person to experience you as the gender you prefer or the sex you want to be seen as? And I think you're so right that for some people, as long as all of the bells and whistles match up with the category that they want to be seen as, it's good enough. And then I think the people who are able to understand that deeper question of like authentically being perceived, they're the ones who end up having the bubble burst, the fantasy burst. So that's very interesting.
I think what you're saying is the people who are able to perceive on an interpersonal level a degree of authenticity on an interpersonal way, whereas the autistic person, if you call me she, you believe I'm she.
Right.
So the emphasis on pronouns, it's just for everyone else, it's just a word, it's meaningless. But if for the autistic mindset, if you call me she, you must believe I'm she. So as long as you're calling me she, you must believe I'm she. If ever you get it wrong, you slip up, oh my God, you suddenly don't believe I'm a she, you think I'm a he. And it's all about the meaning. So for all of us, we don't care about pronouns. Pronouns, I mean, they're a waste of time. Whereas if you're autistically minded, then a pronoun is an indicator of what you really think of me. And
so therefore, do you think we should roll with this pronouns idea, or should we tell these people who are autistic, I'm not? I'm just interested in your position on pronouns as a result of this very good point you've just made.
So in my group, I had this thing where I said to the group at the outset, for those of people who are post-op, I'll use the post-op pronouns because I think there was something quite cruel not to. For the people who hadn't, I stick with their biological pronouns. And I said that from the outset. This is how we do it in the group, and they were fine with that. Everyone was fine with that, and that was something that made sense to the group. And the group, I mean, it wasn't just me challenging it. The group were challenging each other as well all the time. So any notion of gender was deconstructed by the group, what it meant, so any meaning of anything that was gendered was deconstructed by the whole group, not just me. And the people who'd been in the group for a while were able to do that really easily. So my notion was gender doesn't exist. So you can't. So anything that was presumed to be to do with gender was deconstructed because gender's a social construct. It's like religion. It's something that we've created to make sense of something, but it's essentially not there.
And have you thought of running the group since? Like it just seems like extraordinary. Here we all are, myself and Sasha and Lisa, and all of us inundated with clients left, right, and centre. And there is this group that we have all read about and got excited and thought about. And I'm thinking, why aren't we running it even once a month in a city or something? It just seems extraordinary.
I would, but I suppose I'm a clinician and I'm not clever enough to know how to set up so if I'm in a clinic which does something, I can do it. That's fine. But I'm in the private sector now, so now I see people privately, and it's a logistics thing. So. No, I'd be interested in helping supervise people who do groups in it because that's another way. But I think the Portman was easy because we had all these patients and you could do what you wanted and I set one up. Whereas, I'm probably not clever enough to know how to set one up in the private sector.
I'd be curious what you think of this because you've also seen, we've all seen the population change pretty dramatically. And I wonder if there was a group full of this ROGD presentation type of kid, would that be as effective, or would it be like what some, eating disorder clinics have seen where it kind of exacerbates the symptom, where there's a competitiveness about whose gender dysphoria is the worst? Like, I know that we don't have any hard evidence on this, but what do you suspect would happen if we ran such types of groups with ROGD kids? And as first thing I'd say is, I don't think you could get away with using birth sex pronouns for everybody. I think they would kind of have a rebellion. Yeah,
have you met Az though?
But about the rebellion and the anger, I mean, the other thing I was going to talk about was a clinical term, autistic meltdown. So I don't know whether any of you have seen that wonderful play, The Curious Incident of the Dog in the Night, or read the book. And it's a wonderful portrayal of autism. And if the gravy touches the peas or the peas touch the fish, there's this sort of autistic meltdown. If something doesn't happen as the autistic mind wants it to do, they don't get upset. They get nuclear upset. This Star Wars defense program upset. So you see that with transactivism, because if you don't agree with me, then you don't understand, because the way I see it is the only way. So if you don't agree, therefore you don't understand. Not you disagree. You don't understand. Because to understand would be to agree. And then if you don't understand or don't agree, then I won't just be a bit upset. I will have autistic meltdown. So that's why you get this massive upset of and trying to cancel everyone, destroy everyone's lives, contact your employer, basically try and kill them off. And going back to my clinic, the reason why they preferred working with rapists, murderers, and paedophiles is because they don't have autistic meltdown. Whereas the people who have the trans mindset with a tinge of autism, with the autistic meltdown, cause lots of problems for clinicians. They make their lives hell. So they weren't very keen on continuing doing that work. And that probably goes for a lot of psychotherapists and a lot of psychiatrists. But going back to your ROGD idea, I think you'd have to have a mixture of desisters as well, and people who weren't ROGD, and because you need the counter to offset it. You can't just have a group of people in agreement. Otherwise it would just be like a knitting circle and getting better knitting techniques. You'd have to have a mix and a contrast, and so they can bounce off each other and challenge each other. Because without contrast and differences, there will be no challenge.
And you could have a mix with, let's say, it occurs to me, like with ROGD teenagers and maybe people who are deep in transition but seem to regret it. Like, you know, that is conceivable. And do you think it would work over Zoom?
I've never done a group over Zoom, so I don't know. But you know, all of us were very Zoom wary before COVID, and now we're all completely Zoom happy. So
Zoom accepting.
So you know, I've never run a group by Zoom, but that doesn't mean it's not possible. So you know, who knows?
Our wheels are turning. But I'm curious to kind of fast forward, because you said that you ran this group, then you left in 2012, then you returned. Is that when you went into private practice, or can you kind of pick up your timeline from there?
Well, I went to Australia for a year, then I came back. But then when I came back, I went into private practice. And I think I went from my gender stuff went from doing a whole load of gender work and only writing in professional journals, which no one except the person who writes it reads. But I wrote about my group in 2012 in the advances in psychiatric treatment. But who's read that apart from me and my mother? And then to now, I do a bit of the work, but I speak about it a lot, and I write about it a lot, and I tweet about it a lot, and that's why only in the last few years people have probably known who I am. Whereas the ratio of work to talking has probably, changed. So now I think I'm more useful writing about it in more accessible forms and doing a bit of the work. Whereas before I was doing a lot of the work and no one knew what I was doing, really.
We hope you're enjoying this episode of our podcast. We work very hard to maintain high quality content for this show, and we're grateful to Rhyme and GenSpect for supporting us.
Rhyme, or Rethink Identity Medicine Ethics, is a non-profit organisation dedicated to improving long-term care for gender-variant individuals. Visit rethinkime.org to learn more.
And GenSpect is an international alliance of parents and professional groups whose aim is to advocate for parents of gender-questioning children and young people.
If you'd like to become a patron, you'll have access to weekly transcripts and special Q&As, and you can join our listener community.
Now back to the show.
Yeah, I mean, your name has definitely become so much more prominent as this debate has taken its rightful place in somewhat more of a public eye. I guess, was there a time when you noticed this issue kind of blowing up in the public and feeling like, wow, I actually have a lot of important contribution here? Because you were kind of under the radar. So at what point did you...
I actually thought up until a few years ago I was the only gender critical person, or the only person critiquing gender ideology in the whole world. And I'd go everywhere, and everyone was just adopting an affirmative model. I thought it's just I'm wasting my time talking to myself, and no one's listening. But then I discovered very late Twitter, and I realised, oh my God, there's more people out there. and it was
I
great.
wish I was there that day. You could, what? Who are these people? And could I just say, when you wrote your book, I read your book, and I could see that you were very thoughtful. And I kind of, I went to all my colleagues saying, hey, this guy is, he's definitely penetrating gender. And everybody was saying, oh, I don't know. It seems a little bit as if you're very pro-medicalization. And I thought, oh, no, he's pro-exploratory. Were you very careful writing the book, and was it edited a lot, or was there
I wanted to be very diplomatic. I didn't want to come across as too one-sided. So it's meant to be balanced. And now, I mean, I've got another book that I want to get published, but, the last publisher I talked to said, well, actually, could you make it a very pro-trans book that's happy ending stories and everyone's happy? And I said, well, that's kind of not what I'm writing. I'm talking about sort of the whole gender critical approach, which is, what are we thinking? Why are we thinking this? And why are we castrating children? And is this the right idea? And could there be problems? And they said, oh, yeah, we're looking for like a happy ending type book. So, it's the challenge is finding because the book I would like to publish would be great, and it's very, very much gender critical. The challenge is finding a publisher who'll publish it.
So then you kind of discovered all these other people on Twitter. Was there a precipitating event that caused you to go looking? Like, why did you decide at that point, after kind of working under the radar all this time? You said that you had been speaking about this everywhere, and you seemed to be the only one.
Well, I'd go to gender identity conferences, which are very much of a certain model. And I remember first of all, I was meant to do a conference at the Royal College of Psychiatrists in London in 2010. And it was myself and Julie Bindel on one side of the panel versus Charing Cross on the other. And then Julie Bindel emailed me and said, "Can I call you quickly?" And she called me and said, "Have you Googled yourself recently?" I said, "No, I never really Google myself. I'm not an narcissistic." And so I Googled, and then she said, "There's a 5,000 person demonstration promise to take direct physical action against you and me at the conference." Like, oh, okay. And then the Royal College thought it was safe just to cancel the conference. They cancelled that conference, which the transactionists thought was some triumph over something. And then I went to Australia, and then they flew me over to Darwin, Cairns or somewhere, northern Queensland, to do this be a keynote speaker. And then the organizer phoned me and said, "Oh, you're a bit controversial, aren't you?" I go, "Not really, no." He said, "Well, all these people are really upset that you're speaking." And so, honestly, look, you don't have to invite me. If there's going to be a problem, I said, "No, we're Australian, we're very laid back, and I come over." So I went over, and I was the first morning in the hotel, I was having breakfast, and then someone came up to me with full of piercings and things, and they said, "Are you Az Hakeem?" I said, "Yes." And they said, "Oh, I've emailed you loads of times, you haven't responded." I said, "Well, it's very unlike me." And I took their email address. I went back to my hotel room, and I looked at my inbox. I searched for their name, and they had indeed emailed me several times, but they're all death threats.
I could see that coming.
So that's why I hadn't responded. So that was the sort of, and then I was having conversations with various delegates, and they would go, and they said, why? And the general theme was, why do you even bother? Because you're terrible. You're not, you're not affirming. Why do you just give up? I thought, well, not much support here. And I was thinking about setting up a group and trying to work out how to NHS fund this group in the private sector. And I met with a certain charity run by a couple. I won't say who they are, but and I said, look, I'm thinking of setting up this service, and all they asked me the whole time was, why don't I prescribe hormones? I said, well, there's loads of people prescribing hormones. No one is offering this therapy. And they said, yes, but what these people need is hormones. I said, but can you not see what I'm saying? That this is a unique therapeutic offering that no one else is offering. And they said, but what they need is hormones. And I said, well, okay. So they weren't really getting it at all. They just wanted to prescribe hormones. So I went away, and they went away. And then they emailed me the next day, said, we just realized you're that person who, and then they said, you're that
pro
person
psychotherapy.
Who and trans activists hate you, and I said, well, hang on a minute, this is, I don't know why they hate me, this is all, and they said, no, we couldn't possibly be part of anything you do, because what they actually said, even if you are more balanced and whatever it is, and sort of accepting, and transsexuals have a very long memory, and they won't forget how they used to perceive you. And I thought, this is very interesting. So you're saying they have a long memory, they won't forget how you used to perceive me, but isn't the whole dilemma of the post-operative transsexual that people have a long memory and they still remember them as their biological sex and then being misgendered? I mean, there's a complete mirroring here. If I can't be changed from someone who they demonize to someone who's not actually a demon at all because they remember me as being some sort. I mean, I never was a demon, but how it's complete. It's a complete enactment on the other side. I can never change. How can they change? I can never change.
So there's something really interesting about that, because you very earnestly are kind of reaching out to clinicians that I would say, this is probably not very generous, but are completely off their rockers in a way, and they only see the transition hormone pathway. So it's interesting. You were really earnestly trying to, inform them or have a discussion with them. And I know you call yourself a gender critical psychiatrist. Is that correct? Yeah. Okay, so at this point, do you still have attempted relationships with people who are in the hyper-affirmative camp, or has that shifted over time? Because it feels to me like the activism has really ramped up to a very strong degree.
I mean, in my book that I've got published, I've got a trans activist who contributed a chapter, and she went to one of my talks and she expected to have a fight with me, but realised I was actually being quite reasonable. And anybody who does talk to me realises I'm quite reasonable.
Yeah.
So, and then we got on really well. And she's a trans activist. She's in Australia. She's even flown over and had dinner with me in London, and she wrote the chapter of my book. So, most people who meet me realise I'm actually quite reasonable. I'm not this sort of satanic demon anti-trans person. So it's the fantasy of what someone is and what someone is sort of perceived to be versus what they really are. And all I am is someone who just wants to help people think. For adults, I don't really mind what adults do. You could get a tattoo of a cobweb on your face. I think it would be a great idea. I wouldn't stop you from doing it.
Yeah, the more I think about it, the more we just need public awareness that it's a long and difficult process that carries a very heavy burden. And psychologically, there are probably more satisfying routes we could take. And that would be enough. And then you wouldn't need the whole 2 psychiatrist letters or 1 psychiatrist letter and all that. That public awareness would be a better route to follow.
But I think there's 2 things. There's having a hormonal surgical sex change and gender ideology. And I think the problem we have is the monster that we made of gender ideology. The fact that Stonewall are now trying to champion a belief system which is sort of anti-science and anti-reality. So I think there's 2 completely separate things. Whether people can have sex changes or not is another thing.
Yeah.
But saying that sex doesn't exist and gender exists instead is this fantasy cult religion that we've adopted. And I don't think we should confuse the 2. So, there's nothing wrong with people sort of having biological sex changes, whatever it's surgical, hormonal stuff, that's fine. But if you try and tell me that sex doesn't exist and instead we have over 100 genders, that's fantasy cuckoo land. That's a nonsense. So they shouldn't go hand in hand. And this idea that we don't have biological sex, we just have gender, and gender is what you want it to be, is anti-science, is anti-reality. It's like being a flat earther, and that's what I have a problem with. And the first paper I ever wrote was questioning whether or not the person who believes they're the other sex, is this a delusion and is this a psychosis? Are they mad? And the answer was no, they're not. But I was asking the question. But I think, rather than thinking, are these people mad, are we mad? And I think we are mad because we're now embracing this idea that something isn't real or doesn't exist, as in biological sex doesn't exist. And that's ridiculous. We have gone a bit mad as a society.
You have a great theory about, maybe you want to come in before this, Sasha, but at some stage I'd like you to hear. I've heard you talk about the Goths, the Goth Mark 1, Mark 2, Mark 2.
Oh yes,
I
absolutely.
love this.
Yeah. So as a fully committed goth as a teenager,
I've seen a photo. I will say you definitely wear a goth.
So in North Wales, we're probably a bit behind the curve. So when I was a teenager, I was a very, very committed goth, and I've charted the trajectory of goth in the 5 phases. So Goth Mark 1, which was me, was very severe, listening to Bauhaus, Susie, Virgin Prunes, and we had backcombed black hair, eyeliner, makeup, the whole hog. I remember my mother used to sort of say, "Is this foundation pale enough for you, dear?" And my favourite sentence that she said to me were, "Are all the boys wearing that colour lipstick at 3:00 in the afternoon?" So it wasn't, are they all wearing lipstick, but are they all wearing that colour lipstick at 3:00? It was very specific. I like the specificity to it. So and I remember that when Jenny came into school one day with massive backcombed hair and purple lipstick and eyeliner, we were going, "Oh my God, what are you?" And she said, "I'm a goth." And then within a couple of weeks, there was a pandemic of goths within our school. Everyone was a goth. Any cool person was a goth. And so we were Mark 1. Mark 2 goth was a bit softer, a bit more accessible. So they started into The Cure, and it was a bit more happy, or The Mission. And then towards the end, it was even more accessible, All About Eve and Billowing Sleeves. Goth Mark 3 was they managed to branch out into colour. So you had things like Cocteau Twins, and there was shoegazing, and there was sort of, a bit more sort of less black and white. And then Goth Mark 4 coincided when subculture, which historically youth subculture had been embedded in music. Music was the identity of whether you're a mod, a rocker, a punk, a psychobilly or whatever it is. Then social media arrived, and social media took over from music as being the substrate of your identity. Yeah? So youth subculture changed from music-based to social media-based. And then Goth Mark 4 was emo. And emos, rather than talking about how awful life was, were just sort of self-harm and be emotionally unstable. There was an overlap with borderline personality disorder. And then Goth Mark 5 was what we now see as ROGD, rapid onset gender dysphoria, and non-binary. If you look at all the Goths, Goth Mark 1, 2, 3, 4, and 5, we all looked completely asexual. There's nothing particularly masculine or feminine about any of us. You couldn't really tell what we were. And if you look at photos of me when I started university, you definitely wouldn't think I was male or female. I went on a holiday to Istanbul once when I was 20, and I think everyone thought I was a transvestite prostitute, and I got chased down the street by Istanbul men, and I wasn't sure what was happening. And someone insisted on walking back to my hotel for my own safety. But it wasn't about gender. We just didn't look particularly gendered. Whereas now, someone at school says, "Oh, I'm non-binary," and then there's a pandemic of non-binary. So it's not that suddenly everyone's a transsexual. No, of course it's not. It's a subculture. It's the coolest thing to be. So non-binary ROGD is just Goth Mark 5. But the problem we have is that we've made it into this pseudo-medical condition. So when I was 16, luckily there were no clinics that were treating me and giving me affirmative goth treatment. I wasn't able to get my lips tattooed purple. I wasn't able to get my hair permanently backcombed. I wasn't able, I was just having to do all these things myself. And my mother was buying me my foundation that wasn't pale enough. But now you've got these clinics who are affirming these Goth Mark 5s and saying, what's a medical condition? And, that's the problem. It's a subculture. Let them be the subculture.
I know. I think it's really, I really like what you say there. But I do think it's interesting between Goth Mark 3 and Goth Mark 4, we lost music and we gained self-harming. And it's kind of an interesting point because I think music has huge consolation for teenagers. And I feel very
wonderful.
Yeah. I think it goes very deep.
We used to luxuriate in our melancholy with a background of Joy Division. We're so misunderstood, we're so miserable. Whereas then social media arrives, and look how you can self-harm. It's almost like an instruction kit on how to mutilate yourself. So none of us knew how to sort of be self-destructive. We just sort of think about it, fantasize about. But now then, the emos had social media, and they could look at all these things on Instagram that Instagram pretends doesn't exist, on how to self-harm. And then all of a sudden, you're sort of you become a borderline personality disorder who's self-harming repeatedly. So that was the shift. And now music is just background music. Kids don't really get as excited about music as we did.
I don't think they do, and they certainly don't follow.
No, they're excited about their social media profiles.
Yeah, and there's no obsessive following every song, every track, every lyric. Yeah. None of that. It's not add to the intensity, and certainly not half as widespread or as soul nurturing as it seems to have been. Yeah,
it's all the focus is all on the social media profiles. So it's focused on themselves and their own profiles. That's what I was going to say. Rather than you following a band, it's how many people are following you on social media.
Rather than you looking outward and looking at the godlike, mastery of Morrissey and stuff, instead you're thinking about yourself and how you look and how you come across and how other people might perceive you. And it's just a complete flip, and it's not healthy.
And it's also really lacks creativity and transcendence, all of these labels and even the obsession with mental health diagnoses that you see in a lot of these kids' TikTok profiles or whatever. It lacks the kind of transportation of a fantasy musical artist or the goth persona and the goth aesthetic. There's something really fantastical about that. Now, of course, there is definitely a fantasy involved in gender transition, or the idea that sex isn't real, and all of the ways that a quote non-binary person is blending the aesthetic. But I don't think that there's an opportunity for something, fun and connected in it. It feels very dark in a different way. And it feels interesting too, because there's a demand to be recognized and seen by the outside world. And I don't know if that was true, in your childhood, as when you were fully goth, were you demanding for your parents to play along with it? Was there a difference there as well?
But I suppose what we did was we would love it if someone would perceive as being as a good goth, as very goth. If someone didn't get that we were goth, we were very upset. So if you've got a child who's the goth Mark 5, and they get validated by the school declaring them to be, look, so and so is now goth Mark 5, so and so is now non-binary, or now a female or male or whatever it is, or they go to a clinic and they get affirmed. So all this affirmation is just it's a bit like telling little Az, you're a very good goth, you're very successful, you're the best goth around, you're definitely a goth. And that's, as a teenager, you want to be good at what you're interested in. So it's it's the same formula, it's just a different manifestation. We just perhaps don't need to medicalize it and confuse it for something that it's not. Because what we do know is that most people who question their gender in childhood will not question their gender as an adult. We know that. So the risk is now that we're chemically castrating people because they're the new sort of goth, because we're confusing them for something they're not.
In the gender critical discussions, people are often focused on gender stereotypes and misogyny and all of those things. And I hear you talking a lot about this just being kind of a cultural and social trend. And I definitely agree with it being trendy and being kind of the new subversive subculture. What do you think the role is of our maybe overly rigid ideas about male and female? That kind of goes into gender ideology, right? These kind of categories and boxes.
You can't have gender ideology without gender stereotypes. And, I describe people as being either gender confident or gender underconfident, like a spectrum. And the gender confident person can say, well, I can do this and it doesn't fit in your framework, so your framework's rubbish. Whereas the gender underconfident person goes, oh my God, I'm not quite right. I need to change myself to fit into the framework. And all my trans or gender people, they all describe very, very rigid stereotypes. They all say, well, men like this, 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 and this, women like this, this, and this, and because I don't fit in with this, whereas if you say to them, well, okay, so you're a boy, but you feel that the things about you aren't male. Surely, if they're about you and you're a boy, they are male. They're you just need to widen your repertoire of what it is to be a boy. And the other example I always give that everyone's always sick of me talking about is when I grew up in North Wales, and it's very, very, very Welsh, white, 1970s. We were the only brown family there. My family was like fleeing India to go after the horrors of the partition of India. They wanted nothing to do with India. They wanted no reminders. They went somewhere far away, and all there were Welsh people and sheep and nothing else. We're the only brown family. And I went to school for the first time, and I came home and I said to my mother, Mummy, I didn't think I should be brown. I think I'm just like everyone else. I think I should be white. And her task then wasn't to say, oh yes, you're trans-ethnic, you were born in the wrong body, we're going to get you ethnic cleansing. Her task was to expand little Az's repertoire of what it was to be anything, including brown, and me to build up my own understanding of me as a brown person. And, there's no difference, really, between a child who goes to their mother and says, Mummy, I think I should be a girl, or little Az saying, Mummy, I think I should be white. That you expand that child's repertoire of what it is to be male or female, because children don't know. How does a child know? So if a child thinks that being a boy is this or being a girl is that, maybe they don't have much of an understanding, and maybe it's okay for different sorts of boy or different sorts of girl. Because the ones I talk to don't have a very big repertoire at all. They think that all boys play rugby, they like war, and it's like, well, I hate rugby. So but that goes along with the autistic mindset again, very black and white, very rigid.
It's also the ultimate in what children should have, which is magical thinking, and it's and
creativity.
Yeah, it's their right.
I encourage people to be subversive, because by being subversive, you can subvert frameworks rather than being conformative to framework. Being an adolescent is all about being subversive, and I encourage people to be subversive. If the framework doesn't fit, just subvert it. Don't change yourself. You're not wrong, the framework's wrong.
And have you thought of, or have you approached the Tavistock to say, well, I ran a clinic in the Portman, which is the Tavistock and Portman is the name of that hospital or trust or whatever it is. Have you approached them to say, I ran that group for 12 years and I'd like to run it again?
So I did, actually. So I came back and I said, I'd like to run the group. And they said, oh, no. And they, it's funny because they they're not interested at all. But then I remember going to the chief executive of the Tavistock when I was there, saying how, because I worked in GIDS for a bit as an honorary, and it was all madness, because you'd get sort of Johnny coming in aged 4 or 5, who'd said to his mother, "Oh, maybe I should be a girl," and the mother had watched some 30-minute Channel 4 documentary, was now an expert, and had decided that their child was trans, and had told the school and told everyone, and bought Johnny a wig and changed his name by deed poll. And and I was saying to all the kids were doing was affirming these people, and I was saying, isn't there something mad about this? Aren't you? Why aren't you exploring them? And a very prominent person in GIDS, who at the time said to me, "Is it any more mad than being homosexual or gay?" And I thought, what? And that is an indication of just how steeped in homophobia that institution is. And that institution, who never knowingly have employed any gay consultants or therapists. And I remember when I was trained there, so many seminars, and we had 2 terms on the psychopathology of homosexuality. So it's the transsexual solution was perceived as strange as the homosexual solution in their eyes.
What sort of year are you now talking about?
This is 2012.
Wow.
So there was this is the institution who said to someone who was their only candidate for a job, their home candidate, they took them to one side and said, we can't possibly give you the consultant job because we couldn't possibly be seen to employ a homosexual. So this was 2006. So it's coming from that sort of institution. It's
we need to really flush this out, because people who don't know much about this topic have this perception like, well, if a child coming out as gay in their teens is something that we should accept and support and not make a big deal of, the same should be true for a child coming out as trans in their teens, right? That is the argument that's often used in support of the affirmation model, specifically in an ROGD case. Who cares if it's sudden? Who cares if it's out of the blue? But actually, there's so much homophobia built into this that people don't necessarily see unless they really slow down and examine this all. So can you just say a little bit more about the overlap here between homophobia and the affirmative model?
So, in terms of the affirmative model, if you've got children who question their gender, we know an awful lot of them, most of them, will end up not having a problem with gender, but will end up probably being gay. We know that. So the affirmative model would capture those people who would probably otherwise be gay and not have a problem with their gender, and would put them on a conveyor belt of changing them into another trans sex and a lifetime of hormones and having castrated them beforehand. So in a way, it's a way of cleansing the population of people who would otherwise be gay. And we know that lesbians are becoming obsolete because they're all becoming trans men, because the social media influencers make it far more attractive to be a trans man than a lesbian. And I ask young trans male identifying patients, I said, look, what about you? You said that you were a bit of a tomboy and that you fancy girls. Isn't that a lesbian? They go, no, I'm not lesbian. I said, well, do you know any lesbians? No. Mm-hmm. Do you know any famous lesbians? Can you name me one famous lesbian? They said, no. Mm-hmm. And can you name me any famous trans males? They reel off a whole load of social media influencers. So there's nothing exciting or sexy in the young mind about being a lesbian, because I can't think of any. But so we're kind of getting it's almost like a solution to homosexuality is let's just trans them into something else. And going back to the thing about coming out as being gay or coming out as being trans, it's completely different, of course, because sexuality doesn't change who you are. It's what you like, what you fancy, what you're attracted to. Whereas coming out as trans is saying, I am something else. It's not what you like or are interested in. It's what you are. So, there's no difference between believing that you're another sex, or believing you're another race, or believing that you're another height, or believing that you're another species. They're all, but sexuality has nothing to do with what you are. It's to do with what you like, what you fancy. But this unhelpful grouping of LGBTIQA to Z, people don't see the difference. It's a bit like trans. Trans incorporates what we used to call true transsexuals, transvestites, and within transvestites, I describe 11 different types. There's a fetishistic and non-fetishistic and blah, 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 and there's the autogynephiles, but they're all called trans, so everyone thinks they're all the same. And, so there's no difference between someone who wants to temporarily dress up as a woman because they get sexually excited by it, by someone who believes that they are a woman. And so we're reducing it all into, and now these are all grouped in with lesbian, gay, and bisexual people, and then grouped in with asexual people who don't fancy anything. So we stopped referring to people as either trans or transvestite or gay. We just refer to people as LGBTQI. And you watch the news and they talk about LGBT people, and what is an LGBT person? So I think there's an unhelpful reductionism which results in us thinking that they're all the same.
And I'm also thinking about the importance, when you think about identity development, of having a sense of where things could go if you were a lesbian or if you are gay. And because LGBTQAI has all kind of gotten blended together, there isn't even that helpful distinction, which, there's a really great paper that I will link in the show notes about lesbian identity development. And many of the individuals interviewed said that as children, they felt very confused. They wanted to be boys. They had what you would consider gender dysphoria. And it wasn't until they met other lesbians that could show them, actually, it's okay to be this way. It's okay to express yourself this way. It's okay to have these preferences, and gave them an idea of what was possible, that they were able to move forward in their own identity development. And because we've created this new category of person, it's not totally new, but this trans category, it kind of fixates the mind of the young dysphoric person that these are the possibilities for me, which is becoming a trans man and transitioning and having top surgery. And so when we eliminate the other possibilities, of course, we see everyone going down one pathway.
Yeah, absolutely. And the idea of top surgery, I mean, it's such a sanitized way of saying a double mastectomy. It's
bottom surgery. Bottom surgery isn't even the right word. Like it's just absolutely, it's playing with language. It's.
But I had a patient who said, "Oh no, I'm not a gay man. I mean, I couldn't be a gay." I said, "Well, what do you mean? You're biological male and you fancy men?" No, but I don't like gay bars and gay clubs. And that was their rationale for not being gay. I thought, well, that's interesting. Being gay isn't about going to gay bars and gay clubs, don't you? So,
how do you see it going forward now? How do you think the UK is? And I know there's been an awful lot of huge moves in the UK recently.
I think that there's a tsunami awaiting to happen of people who will regret. And up until now, there's been a trickle of regretters. But then I think, 5 or 10 years, there'll be an explosion of people who've said to the health service, what have you allowed me to do to myself? There'll be a lot of legal cases, and there'll be a generation of people who are physically, sexually displaced through what can only be described as iatrogenic harm, and the health services doing harm. Whereas now you go to the people who feel that they're doing the right thing, and they feel that what they're doing is right and helping people, but they're not actually. And so there'll be a wave of these people regretting. So we just wait for that to happen, really.
It's an incredibly sad idea that's what might happen.
Well, the two things that are worrying are the huge amounts of regretters, but also the fact that we seem to have ditched reality and science and embraced this strange cult-like thinking, which has been capturing everyone, sort of, and it's like the Emperor's New Clothes. They don't really think that, but they're being seen to say it. Not just politicians who just do what who are dishonest at the best of times, but royal colleges of medicine, and they all seem to be captured. It's strange.
Well, one of the ways that, because I've been studying mass psychoses, trying to understand the current moment that we're in, and one of the ways that societies have brought them to an end is by calling out reality and speaking in reality and kind of having those conversations far and wide. So we're very grateful that you've come on to contribute to these types of conversations on our show. So thank you so much for having us, or for us having you, I suppose.
The pleasure was mine. Thank you very much.
Thank you.
Thanks for joining us this week on Gender, A Wider Lens. This podcast is sponsored by Rhyme and GenSpect, and listener support means a lot to us. The best way to help is to subscribe and review us on iTunes.
Follow us on social media, and if you'd like to become a patron, you'll have access to weekly transcripts of the show, special Q&As, and you can join our listener community. Just go to our Linktree. That's linktr.ee/widerlenspod.
Our discussions are for educational purposes only and are not intended as a substitute for mental health services.